Hi everyone, this is Dr. Pasunuti Sumanth, consultant pediatrician. As we are all in midsummer and the temperatures have already peaked over the past few weeks, here is a video regarding the care to be taken for children in this summer. The main culprit in this summer is the ultraviolet radiation from the sun, and this can cause sunburn, skin damage, eye damage and skin cancer. This ultraviolet damage accumulated during childhood and adolescence is strongly associated with an increased risk of skin cancer later in life. Skin cancer is one of the most preventable cancer. You can protect your child from the sun by teaching them to become sun smart and always using sun protection when UV levels are higher. And it is also important to model good sun protection habits as children learn by observing their parents and caregivers' behavior. Now we'll see about the sun protection times. Ultraviolet radiation isn't like the sun's light or heat, which we can see and feel. Even on a cool day, ultraviolet radiation can damage our skin without us realizing. Which is why it is important not to rely on temperature to decide whether sun protection is needed. UV levels are usually 3 or higher in the spring and summer months, and UV levels are most intense during the middle of the day, so if possible, try to save trips to the playground, park or beach for early morning and late afternoon. Now we'll see how to be sun smart. Put on clothing that covers as much skin as possible and choose lightweight, loose-fitting clothing that won't make your child too hot. Next thing is to slop on sunscreen. Use SPF 30 or higher broad spectrum water-resistant sunscreen on your child's face, arms, hands and any other skin that is not covered. Apply sunscreen 20 minutes before going outside and if possible reapply every 2 hours. And remember, sunscreen does not completely block out all UV radiation and should never be the only method of your sun's protection. Next is to slap on a hat. Choose a hat that shades your child's face, back of the neck, eyes and ears and is a suitable size for your child's head. And next, seek shade. Try to use shade whenever possible. If you can, choose a shady place for your child to play, such as under a tree, shade sail or umbrella. And remember, UV radiation can burn even when you are in the shade. So it is important you and your child also wear sunscreen, hat and appropriate clothing. Next is to slide on sunglasses. Sunglasses are labeled with protection category ratings, which indicate how well they protect the eyes from the UV radiation. Choose wraparound sunglasses that are labeled category 2, 3 or 4. Category 1 or 0 sunglasses do not provide enough UV protection, and a soft elastic tip will help to keep sunglasses in place for babies and toddlers. Now we'll see about sunscreen in babies. And babies under 12 months should not be exposed to direct sun when UV levels reach 3 or higher. And dermatologist does not recommend the widespread use of sunscreen on infants under 6 months. Protection such as shade, clothing and broad brim hats are the best protection for infants, and with sunscreen used on very small areas of skin. Some parents may worry about their child's skin reacting to sunscreen. There are many sunscreen made for babies or toddlers that are gentle on sensitive skin. If you are in doubt, test the sunscreen on a small area of your child's skin to make sure they don't have a reaction. Now we'll see the treatment for sunburn. Children can get sunburned in as little as 10 minutes, and depending on the severity, it can take a few days or weeks to heal. So the treatment aims to help your child feel more comfortable. First thing to do is give your child plenty of water so that they are well hydrated, and cool your child's skin with cold compresses or a cool bath. If required, give your child simple pain relief medicine such as paracetamol or ibuprofen and prevent further UV damage by keeping your child indoors. And signs of severe sunburn include blisters, swollen skin and severe pain. If your child has any of these signs, take them to see your doctor. Sometimes children can get heat stroke along with sunburn. If your child's sunburn is accompanied by fever, headaches or nausea and vomiting, take them to the doctor. So this is all about the sun protection in children. And thanks for watching. Do like, share and subscribe.